And now on the line is Michelle O'D. Michelle is a desk officer for Sudan and Malawi with Concern Worldwide. Michelle, welcome to the program.
Hi, how are you? Thanks for having me on.
Okay, good, thanks, Michelle. Michelle, I got in touch with yourselves in Concern to do this interview today with you to talk about what is going on in Sudan at the moment and to learn a bit about what you in Concern are doing in the country and calling for. Before we talk more in depth about what is going in Sudan at the moment, can you give our listeners today on Near FM, Michelle, a bit of a summary of your background working for Concern and the humanitarian area in general first, please?
Yeah, well, personally, so as you say, I'm the desk officer for Sudan. And that essentially means that I act as a central hub for communication between field teams in country, headquarters, and other stakeholders like government donors. So that's kind of helping ensure that every aspect of the response is well coordinated, efficient, and effective by providing situation analysis, managing funding applications, recruitment, reporting, accountability, and as well as supporting advocacy and liaising with government agencies and other NGOs.
Okay, so you're based in Ireland, are you?
I'm based in Ireland, yeah. I was actually in Sudan earlier this year as well, supporting with the setup of a new program and visiting the health centres that we support in Darfur.
Yeah, I've done loads of interviews with, Breda Gahan from Concern. I've done
I do,
loads of
yeah.
interviews with her for the last 10 years, and I know that she travels, I think she's retired now, but I understood that she travelled a good bit. Just curious
Yeah.
about that. Okay, Michelle, I've covered the conflict in South Sudan a few times on Near FM over the last
Mm.
10 years. Can you give our listeners today a bit of a summary of the relevant history in Sudan that has brought us up to the present day in the country?
Yeah, absolutely. Well, so I guess to give some kind of background, the Republic of Sudan itself is a massive country. It's in Northeast Africa and it's got a population of 50 million people, so it's pretty huge. Since 2021, Sudan had been under military rule after a coup overthrew the government. And then in April last year, in 2023, conflict erupted overnight, basically between two military factions who had been sharing rule of the country since the coup. Um, so the conflict had started in the capital in Khartoum and then spread quickly throughout the country. And then what we're seeing now is a continuation of that conflict, and it's also kind of spread to different parts of the country and it's awoken different ethnic conflicts as well in different pockets of the country. So it's quite a complex, protracted crisis at this stage. And really what we're seeing is it's a humanitarian crisis of unprecedented scale. Um,
Okay.
yeah.
Okay, you can talk more if you want about the history. No, I'll ask you. You just gave me the history summary. Michelle, what's the difference
Yeah.
between Sudan and South Sudan?
Well, Sudan and South Sudan, they used to be a unified country, and then I think it was in 2008, South Sudan gained their independence from Sudan. So that followed quite a difficult war as well at the time, and then South Sudan then was plunged into a civil war following that break from the Republic of Sudan. But since then they're quite separate. Although there is a lot of movement between the borders, or across the border between the two countries. Obviously, they're still quite connected, and so that's what we're seeing in Sudan at the moment as well. A lot of refugees are moving from the Republic of Sudan back into South Sudan.
Okay.
And we're also seeing refugees who'd fled from the war in South Sudan, who had moved up to Sudan for safety. They're now returning back to South Sudan on the back of the war that's happening now in the Republic. in the
So
northern part.
are you saying the civil? I don't know if the civil war in South Sudan is still going on, but are you saying what's going on in the Republic of Sudan and the civil war in South Sudan, they aren't really connected? Like,
They're not connected. No, this is quite a separate crisis.
okay,
Although I guess the Republic of Sudan as a country has been in quite a difficult situation for quite some time. So, like, even looking before April of last year, when this current war broke out, before then, you already had 15 million of the people in the Republic of Sudan, in the northern Sudan, who were reliant on humanitarian aid. Now, since April of last year, that's after shooting up to 25 million people. So that's half the population are reliant on humanitarian aid today. So that's a massive increase in a short space of time, and that's directly related to this conflict. So Sudan over the last couple of decades have seen a huge spurt in growth and in development, but this war over the past year has really set them back quite a bit. So we're seeing that. We're seeing a huge amount of displacement, this conflict. So since April of last year, so that's just over a year and a half, has seen over 11 million people who've had to flee their homes, have to leave their homes, and many of those have had to move multiple times in that time. So that's 11 million people, but most of them have moved to safer parts of their own country within Sudan, and then there's about over 2 million have moved to neighbouring countries like South Sudan, as you mentioned, and then also Chad over on the east coast, Ethiopia as well have taken a lot. So these are also their countries who are facing a lot of their own challenges. Like, as you mentioned, South Sudan are recovering from quite a difficult war themselves, and they have their own poverty crisis as well, and they're taking in a lot of these refugees and also returnees who've come back over the border. So that is, it really is, it's the largest displacement crisis that we have seen worldwide. And it's one of the biggest humanitarian crises that we're experiencing right now in the world. Civilian casualties are there's huge, and it's likely very underreported. Food insecurity is a massive issue. We are seeing approximately 26 million people who are facing acute hunger. So that's over half of the country's population. And then we're seeing famine conditions in parts of North Darfur, so where over 700,000 people are experiencing famine right now. So that means children are already dying. Yeah, and there's a further 13 regions in the country who are at high risk of famine as well. So, like, linked to this, we're seeing child malnutrition rates just skyrocketing. So there's almost 4 million children under 5 that are suffering from malnutrition this year. So it really is. It's a very difficult situation we're seeing, and compounding that, the conflict has led to the healthcare system collapsing. So over 70% of the health facilities have been declared non-functional. And there's very limited access to essential medical care. So it's a very dire situation that we're facing.
So are you saying that some people, no, not some people, but there are regions of Sudan now where there's actually a famine happening now? Is that true?
Yeah, absolutely. Yeah. So in North Darfur, in a place called Zamzam Camp, which is a refugee camp and home to over 500,000 people, has been declared in famine. So we're seeing people die each day due to starvation and famine conditions.
And do you know how many people have died through famine and through conflict since last year, Michelle?
It's very hard to say. So the estimates are up over the 100,000 mark from the conflict. And as I said, that's likely underreported, as well as it's very difficult for people and reporters to enter the country and to actually report from there. So it's hard to get the proper figures out. But as I mentioned, concern, and also with the collapse of the healthcare system, it's hard to get the numbers of how many people are being reached, and then also a lot of the population isn't able to access the healthcare that they need. So that is one of the areas where Concern is working. We as an organisation, since the beginning of this year only, we've reached over 250,000 individuals across 90 healthcare facilities across the country. So we're working with a lot of these people who are experiencing this awful level of malnutrition and hunger, mostly women and children under 5. We're also providing cholera prevention and response, because there's been cholera outbreaks as well as measles outbreaks and different outbreaks of diseases, which is also obviously compounding the situation there. And we're providing emergency nutrition and health support to pregnant women and children mainly. And we're doing that a lot through static health facilities, but also through mobile health facilities to get to people who can't reach the clinics or have been displaced from their own homes and have got no way to get the support that they need.
I only learned this in the last year or so, talking to Breda Gahan on Nera Famines and another lady from Concern. I forgot the name off the top of my head, but they were saying that, like, when there's a famine going on or famine-like conditions, like if kids, for example, are extremely malnourished, even if they get food at the end, their bodies are so kind of harmed that even if they get food, most of the time they'll still die because their body has given up so much. Is that true, is it?
Well, yes, like starvation and malnutrition really does affect the human body quite severely, and it's very, very difficult to overcome it. And I suppose that's also what one of the really desperately sad things about this conflict is, that even if the violence were to stop tomorrow, which there's no end to it in sight, it would still take years to recover from the devastation that it has had on the country, in terms of hunger, in terms of malnutrition, in terms of children who have been outside of education for such a long time. There's also a huge trauma that the population have obviously experienced. Gender-based violence and sexual violence is also rife and been used as weapons of war. So there's really there's an awful lot that people have gone through, and we can provide support, and we are providing support, but we need so much more to answer the needs that are growing, going to be more and more compounded the longer this war continues.
Okay, Michelle, it was great talking to you today on Near FM. You have to give me and our listeners today on Near FM a very good summary of what's going on in Sudan at the moment. Going forward from here on in, Michelle, can you tell me what yourselves and Concern are calling for in the country and around the world? I mean, including big actors like the EU and US. What are you calling on everyone to do, Michelle?
Yeah, well, like as I said, really what the country needs is a cessation to the violence, to the hostilities. Without the end to the violence, there's only so much we can do. And our support is a temporary bandage. So we need Ireland and the EU to use its diplomatic weight to push for a cessation of hostilities and a return to civilian rule. We also need urgent humanitarian funding to address the needs that are there at the moment. There's obviously the needs are critical and they're growing. So we do need more and more funding to actually reach these people. And connected to that, we need safe humanitarian access and protection, and that's something that's missing and can be quite difficult. But it's essential for ensuring that humanitarian organisations can reach those who need it most. So at the moment, it can be tricky to get supplies in and into the healthcare facilities that we are supporting, and so we'd love to see governments hold the parties to the conflict accountable for ensuring and guaranteeing that safe access for humanitarian workers to reach those in need.
Michelle, is there anything that the Irish government can do that they aren't doing at the moment?
Well, the Irish government are doing quite a bit, and they are advocating on the world stage to try and push for an end for a ceasefire. There could be more done in terms of trying to. There have been peace talks, but the parties to the conflict haven't always attended them. There could be more done to advocate, to, as I said, hold them to account, to engage in peace talks and engage in ceasefires, and really stand by their word for when they are allowing humanitarian actors into the country, that we are being guaranteed safe access and safe passage, and the supplies are being allowed in and to reach those most in need.
As well as the Irish government, I believe the Irish MEPs potentially could make a significant difference as well, couldn't they?
Absolutely. And again, in the same vein, I think Ireland has always had quite a strong voice internationally, in the European Parliament, and more globally as well within the UN. And I think that we can use that, and we can utilise that to really push for more attention to be paid to this crisis, which really is one of the largest humanitarian crises affecting the biggest number of people and children at one time. And we can use our voice to bring more attention to this, and try to force those responsible to come to a ceasefire, and to allow support to reach the people who are innocent and suffering for no good reason.
Yeah, the scale of this crisis is hard for me to get my head around, you know.
Yeah.
Like, I know conflict, there's other conflicts around the world as well, physical conflicts, war conflicts, but for the number of people dying, it's hard to get my head around, you know. Okay, Michelle, is there anything
It
else
is
you want
hard
to
to
say?
comprehend. No, I think that's it. Maybe also just to really thank all the donors for and people who've been donating to Concern in Dublin. They've what we're doing would not be possible if it wasn't for people like you who have been supporting and donating, and that it's very much appreciated, and the money is going to where it's needed most.